Well, thank you everyone for joining me today on this month's edition of Office Hours. Today is just a Q&A, so it might be a pretty quick one. We just had the 4 questions in this week, so let's get into it. Now, if you do have a question, you can type it in the chat anytime you like, or you can just put your mic on at the end and I'll get to the questions at the end. First of all, Murray asked, what do you do for black toenails and blisters under toenails in cricket fast bowlers where their big toe hits the end of the shoe? Really good question. Toenail blisters are a little bit different to most blisters. So if you've watched any of my stuff before, you know that blisters are caused by skin shear, and it's to do with the friction at the skin level or between the sock and the shoe. However, in toenail blisters that occur under the toenails, it's a little bit different. So what happens is the bowler comes in, the forefoot hits the ground, so the heel hits the ground, the forefoot hits the ground. They've got sprigs, that's in the wicket, their shoe's not moving anywhere. However, their foot is going to keep sliding forward. And so, sorry, if I just use this for the ground, so the shoe hits the ground, but the bones of the foot are going to keep moving forward. Now, if you think about the fact that you've got a nail on top here, the bone's moving forward, and then the nail comes to an abrupt end when it hits the end of the shoe. So knowing that the nail is adhered to the nail bed, which is the skin under the nail, bone's moving one way, that way, the nail moves with it until it hits the end and the bone keeps moving, and that's where our shear comes from. So every blister is caused by repetitive shear deformation. That's just a little bit of a different scenario in how we get the shear. So what do? Well, really, the shoe's got to fit for starters. Now, to my way of thinking, we need the width of our thumb between the end of our longest toe and the end of the shoe. If we aren't starting with that, well, that's the first thing you need to fix. We also need to lace that shoe up firmly on our foot to try and hold the heel back so the toes aren't in the end of the toe box. And these 2 things really, I don't know, should they go without saying? Probably not. We should probably should say them. And if our foot, there is massive force making our foot keep going forward, but it is not the job of the toenails or the end of the toes to bear the brunt of that force. So really, to my way of thinking, this is a failure of the footwear to adequately meet the needs of the activity, in this case, fast bowlers. The whole shoe and the firmness with which we lace up should prevent our foot from sliding too far forward. But let's say we've maximized that as much as we can. Well, the next thing that we can do is toe box modification. And this is done a fair bit. And I think in the absence of anything else, if you literally can't get shoes that are long enough, because I mean, the answer is not just get increasingly long shoes, because your foot will still slip forward. And if there's just no way that you can get the laces tight enough, then you have to modify the toe box. That is cutting it out, and whether you need to cover that over with a bit of something to make it so your sock's not poking out. I see plenty of fast bowlers with their socks poking out. That is legitimate. That is a legitimate thing to do. Is it ideal? No, I think the shoe should be able to hold the foot back, but I mean, I'm not really involved in the footwear industry, so, and certainly not in cricket, so there must be some pretty severe limitations there. One other thing that should go without saying is toenail maintenance. If these fast bowlers have been bowling a long time, and the toenails have borne the brunt of that impact, then their toenails are probably going to be pretty gnarly and thick. So we don't need the thickness and the length of the toenail to be adding to that to any degree. So we should really be cutting those nails back, filing them down as much as possible. So they're the relevant factors there, Murray. I hope that helps. Rob is a runner, and I spoke to him in the week, and he mentioned that he's getting blisters on the ends of his toes, so apical blisters, because he can't lace his shoes up due to a tibialis anterior tendon irritation, and so his toes hit the end of the shoe. So when I was talking to Rob, we were just trying to figure out what the cause of these apical blisters were, because it's going to be one of two things. It's going to be the toes clawing or the toes hitting the end of the toe box. And we established it was the toes hitting the end of the toe box. And tibialis anterior tendon irritation is a good reason to not be able to do the laces up right up towards the front of the ankle, because of course the more we do them up that high, the more we can keep the heel at the back and the toes out of the end. So we had a quick chat and we talked about lacing technique, and also this idea that actually comes from cricket shoes is he could get his bootmaker to retrofit one of these Velcro locking straps, and you could just position it wherever you wanted to, I suspect, so as to not further irritate the tibialis anterior, and that would just be something additional to the laces that is clamping down on that foot and not allowing it to move forward. But obviously in this case it'll be in a running capacity. But before he went to that extreme, I suggested that he just try this lacing technique. So this is the same shoe, my shoe, just lace it as normal. And when you get to this level here, just stop lacing. So the medial side here on the left is where the tibialis anterior tendon is. And on the right, just keep threading those laces through on the right-hand side, and then do your knot and bow as per usual. So Rob's giving that a go. I haven't spoken to him to see how that's going, but if you're not aware of that lacing technique, that is something that definitely can help tibialis anterior. But otherwise, we've just got to somehow, and increasingly long shoes is not necessarily the answer, because that means they're going to get bigger and the foot can still end up hitting the end of the toe box. So it's all about lacing in this case. Jess asked, best blister treatment during a tennis match. Well, I can tell you, Jess, that it's a bit more than what I often see with the small amount of blister treatment that you do see in tennis matches on the telly. It should be more than just a dressing and a donut pad. The donut pads that I've seen the medics make there, I think they're Physios, is just some foam stuff, and they put lots of little slits in it so it can create a circle and take a bit of pressure off that that blister area. However, I doubt that's really going to do much. And we know that meaningful blister treatment, which is what everyone wants, they don't want just token. Meaningful blister treatment means that the blister will stop hurting, or at least hurting as much, and may even start to have some sort of might even be able to start healing, or at least stop getting worse. And that is when we implement the prevention. So yes, we need to do the first aid. That's the betadine and the Band-Aid. And the important thing to make it stop hurting and start healing is the blister prevention. So it depends on where that's going to be in the on the foot. So for my way of thinking, it depends a little bit on the stage of the blister, but I think Ango patches are bang for buck when you're doing sort of courtside care, because it's not going to impact on how the shoe fits. And for most blister areas, or many blister areas, it's going to reduce friction significantly without any downsides. When it gets to around the toes, depending on where it is on the toes, the Ango patch may work, or you might want to try and get a gel toe sleeve in. Again, it depends. You'd want to have a good dressing, because you don't want that gel in direct contact with the blister. So Jess, that's kind of a roundabout and generalized answer, but if you've got any specific questions or a photo you want to throw my way, I can give you some really specific advice. Just generally, the idea of blister management is that there's 5 stages to the process. So ideally we start and we finish with no blisters. To do that, we need to kind of predict blisters, and blisters are relatively predictable. Maybe not when you're going to get them, because, you know, who knows how long a tennis match is going to go. But certainly you'll know where you're going to get them, because you would have had one there before, almost certainly. So the blisters we've had before are the ones that we're going to get again. You should basically expect them and implement your best prevention to stop them from happening. If you don't do enough there, then you need to take action at the hotspot stage. Now, you still have to do the same prevention at the hotspot stage, but you just have to make sure that you stop in time and that you've got the stuff with you. And that's not always possible, or not always practical, or not always at least planned for. So the hotspot is a bit fraught, because really a lot of athletes, they ignore the subtleness of the hotspot stage. Hotspots aren't pain, it's that subtle feeling of warmth. And once it gets to pain, the blister tear under the skin has actually already happened. You might not see a blister when you take your shoe off, because it can take 2 hours for it to fill, but a blister will be on its way. So that's your last opportunity for blister prevention. If you don't take enough action there, then you'll end up with a blister, and his roof will start intact. And the good thing about this blister is it can't get infected because the skin's intact. So the idea is just protect it with a dressing, an island dressing like a Band-Aid. But that's not enough. You still have to implement the prevention, because remember, blisters aren't caused by rubbing, they're caused by shear. Now, if you cover the blister, you've eliminated rubbing, but that's not the aim of the game. You haven't actually eliminated shear. So that's what your prevention strategy does. That's the whole point of it. Blister preventions are trying to minimize the magnitude of shear deformation. And a simple dressing doesn't do that enough. So it's first aid, which in this case is a Band-Aid, and your best blister prevention strategy, which you could have had in place right at the start. If you don't do enough at that point, what will happen is the roof will tear. When the roof tears, then the blister fluid can come out and bacteria can get in. So now you need to worry about infection. So it's betadine and a Band-Aid plus your best blister prevention. And then if you don't do enough at that stage, you will end up with the blister de-roofing. So there'll be no blister roof there at all. And you can do the same thing. It's still betadine, it's still a Band-Aid, or you can use a hydrocolloid at this stage. This is the only blister you should use a hydrocolloid at. If it's in the thick of an athletic tournament and you're not able to implement great prevention, then it's probably a bit of a waste of a hydrocolloid. Just go with your Band-Aid, and then once the game is finished, you want to accelerate healing by putting on a hydrocolloid. So yeah, that's basically the 5 stages of blister management. And the thing that we really need to get across to our clients is that prevention is mandatory at every stage. So why not just do it right at the start? And you can save yourself the trauma of the stopping and betadine and carrying stuff and blah, blah, blah. Hope that makes sense. And the last question was from LJ. What have you got on your blister kit? This is a great question. LJ, I've got 3 blister kits that I sell. I've got a blister lance pack, which just has, people want to pop blisters. So basically I've put some stuff together that allows them to do it safely and without the risk of infection. So it includes all sterile components. I've got the advanced blister kit, and this was the first blister kit I put together, and really it's sort of a hybrid first aid kit, blister kit. So it's got some staples like some sterile cotton wool, buds and betadine and that kind of stuff. But then it's got the real good stuff. So it's got Engo patches, hydrocolloids, gel toe protectors. So it's a great little kit for sort of day trips, just if you need to troubleshoot a blister on the go type of thing. And then the Ultra Blister Kit is one that I put together with 6-day ultra marathons in mind, which is the ultra marathons that I do foot care at. And it's got tons of stuff. It's the OG and great for ultra marathon, but great for team sports, great for if you are going on a multi-day hike, great if you're doing foot care at an event. It's got heaps of dressings in it. Yeah, so there's a bunch of stuff in there, so you can go online and have a look. Otherwise, if you are asking about what I take to the races that I do foot care at, they would be under a few topics. So just some really general infection control stuff, makes sense. Dressings and tapes. So I take fixable and rigid sports tape, and then some dressings plus some hydrocolloids. For pressure management, I take felt, Poron, and Spenco. For coefficient of friction management, I take Engo patches. If people want to use something else, let's say it rains and we can't use Engo patches because they need a dry surface to stick to, then people need to bring their own lubricants. I generally don't take lubricants. Shear absorbed, mainly because people have to reapply them so frequently and they kind of need to do that in their own time when they stop, when I might not be at the race. Shear absorption, we use gel toe protectors and the Spenco and Poron. Biomechanics, take the 5-degree EVA wedge strips. Heel lifts we use a lot because there's always some tibialis anterior DOMs in these races that are a bit on like concrete paths. And I take some Met domes and then some surgical equipment. I mean, I've kind of stopped taking nail clippers mainly because, I mean, if you can't be bothered going to a 6-day ultramarathon and not doing your toenails, you kind of deserve blisters. Sorry, I'm in a funny mood today. And then once you've got a blister, it's really difficult to cut people's toenails because it's really painful. But yeah, I took a Dremel as a nail drill to Birdsville one year. I used that a couple of times. That was pretty good. So that is basically that. I've just popped in. This is the chart that explains how blister preventions work. Always have this in mind when you're treating blisters or when you have a patient in and they are asking you about how to prevent blisters. This is how I approach every single blister that I ever see, treat, look at, hear about. You know, this is what's going through my mind. And finally, if you want to get a replay, this has been a really short one. If you want to get a replay of any of the episodes of Blister Prevention Office Hours, then just head over to pro.blister-prevention.com and go to Learn. And if you click on that drop down, you will see Office Hours replay. So that's it. Any questions? No questions? I'll just give you a minute or two. No questions. Okay, guys, thank you again for joining me. There will be no office hours in January. We'll be back in February. Who knows what we'll be talking about. If you want me to talk about something specific, get in touch and I'll probably make it happen. So for now, have a great silly season. I hope you're having a bit of a rest over Christmas, New Year, and I hope the new year is a good one for you. And we'll see you on the first Wednesday in February. Thanks a lot. See you guys.